On August 2nd, 1990, Saddam Hussein invaded Kuwait. And by August 15th, I was assigned to the 1st Marine Division and deployed to the Middle East. My orders were to direct the emergency room of a forwardly placed field hospital. I spent 7 months in the desert. I trained my corpsmen, and we readied for war. And the proudest moment of my life came during one mass casualty, when the Kuwaiti interpreter said to me, if this was my country's hospital, all these men would die, and none of them died. We took care of Marines, United Arab Forces, and Iraqi prisoners, and I'm proud of my service. But boy, was I glad to come home. Thank you. My wife is also in the military. She's also a physician, and we completed our military commitment, and family ties brought us back here to Maine. And when I arrived in Winthrop, I was asked to become involved in my town's Communities for Children program. And I helped to write a grant that brought federal funding for an America's Promise Fellow to the town of Winthrop. And he helped to organize our after-school and mentorship programs. And then later I helped the high school principal write a grant to develop a service learning program. In my pediatric practice, I found foster care was fragmented with a complete lack of mental health services. So I worked with the Department of Health and Human Services, and we created a program called PrEP to improve medical and mental health care for foster children. This program serves families in 6 counties in Maine, and over the last 10 years, I have personally evaluated and delivered care to over 1,500 foster children. The program has been recognized with 2 Special Achievement Awards by the American Academy of Pediatrics. In my general practice, families told me they needed easier access to mental health services. So I wrote for and was awarded a grant to integrate mental health into the primary care office. I recruited a child psychiatrist to teach doctors to identify and treat mental health disorders, and my program provided mental health access for over 200 additional visits per year. So I've had success. My wife keeps telling me not to rush. I've improved health care for the people of Maine. I've been able to bring over $2 million of federal grant money to train providers in evidence-based care, and I've helped to bring an electronic medical record to Augusta and to Waterville. I've worked closely with the state government. I've testified before the Appropriations Committee and the Department of Health and Human Services Committees. I'm on the executive committee for the Maine chapter of the American Academy of Pediatrics. I've served on the State Disaster Terrorism Work Group, and I'm the vice chair of the Child Death and Serious Injury Review Committee for the state of Maine. So why am I running for Congress? In September of 2007, a father came into my office. He brought his son, and he was complaining that the boy was having headaches, stomach aches, and he couldn't sleep at night. And I said, the last time this happened, you were in Iraq. When are you going back? And he said, next week. And then I asked, how long are you going for? And he said, 15 months. 15 months is a very long time. This was his second deployment, and he takes a cut in pay when he goes as a reservist. What can I do about this as a doctor? We need a lasting peace that allows us to bring young men like this home to be with their families. We need the courage to succeed. The war in Iraq has been a humanitarian and economic disaster. When we entered, Donald Rumsfeld said that there would only be one outcome. We'd free the Iraqi people, they would govern themselves, and we'd leave within a year. That didn't happen. There are those who say we should pull out now, and I have a lot of respect for Mark Lawrence. But they say if we pull out now, there'll be one outcome. The Iraqi people will rise up and govern themselves. It didn't happen when Rumsfeld said it, and I don't think it's going to happen now. To those who say, let's stop funding the war and they'll be forced to bring our troops home, I can only reply, I've been to war, been there when those at home were talking about cutting funding completely, And what happens before the withdrawal is that the troops don't get the right equipment and the doctors and nurses don't get the basic medicines they need to save lives. More people will die. We need to do this thoughtfully and carefully. Madeleine Albright has said there are 3 potential bad outcomes from this conflict. First, Al-Qaeda will have a safe haven in Iraq. Second, Iran takes over Iraq. Or third, the region descends into sectarian violence that spreads to Turkey, Lebanon, Jordan, and Saudi Arabia. The Democratic Party has proposed a strategy for building the peace. We need to support this strategy. We need the courage to help it to succeed. We have a costly, fragmented healthcare system in the United States, and it is not patient-centered. Next year, we'll spend $2.9 trillion on healthcare. That's the same cost as the entire Iraq war. This has a major impact on our economy. We need universal access to healthcare, but in a system that costs less and provides better care. We need the courage to succeed. We need a healthcare system we can trust. There's an organization called the Commonwealth Fund, and they've shown that our healthcare is poorly coordinated, that we're trying to provide chronic disease care in a system that's designed to treat acute illness. We need to implement information systems that help doctors provide better care. Rural communities in Maine don't have access to specialists. We need to implement technologies that enable patients to see specialists located hundreds of miles away. We need the courage to succeed. Proposals have already been put forth by Democrats in the House and the Senate that allow for universal coverage and are cost neutral. This means no more bankruptcy from healthcare costs, no more deaths from the lack of healthcare, and all with no significant increase in taxes. We need the courage to succeed. We need to end our dependence on oil. And as China uses more oil, the price per barrel will only continue to rise. When oil prices rise, food, transportation, plastics, everything we use becomes more expensive. First, we need to conserve, and individuals can help just by slowing down their driving to 55 or 60 miles per hour. This is a simple thing. We need tax rebates to improve insulation in our old homes. Maine has the oldest housing stock in the nation. And I know from personal experience that when an old home is insulated, it dramatically improves home heating costs. We need to completely redesign the automobile. First, we can increase gas mileage standards. But eventually, we need alternative energy sources like electric or hydrogen instead of gas. You know, gas accounts for 60%, transportation accounts for 60% of the oil use in America. So this is a big priority. We need federal grant dollars to support this. I believe we need a carbon tax, and the money from the carbon tax should be invested completely in developing clean coal and green technologies. And this should be a national priority. We need the courage to succeed. We're heading into a recession driven by the home mortgage disaster. We need improved oversight of the lending industry to make sure this never happens again. We need the courage to succeed. Subprime and other risky investments should never be bundled with reliable ones. Who knows about this? Well, the Congress should know about this. There needs to be transparency, and we need an end to the buyer beware attitude in the marketplace. We have weathered recessions before, and this time is no different. And my dad used to say, you tighten your belt and you keep going. You know, the national debt soared under Ronald Reagan. Unemployment went to 11.5%. Interest rates were 20%. With Bill Clinton in the White House, unemployment dropped to under 5%, interest rates fell to 5%, and the national debt decreased. We need the courage to succeed. With your support, I will work to reduce the national debt. With your support, I will work to improve our green energy systems. With your support, I will work to reform our healthcare system into the best healthcare in the world. With your support, I'll work for a lasting peace in Iraq and improved diplomatic relations in the Middle East. I'm Steve Meister. Together, we have the courage to succeed. Thank you very much.